morning again, everybody, and welcome to this incredible space here in the centre of Bendigo at one of the most beautiful town hall buildings I think I've ever stood in. And for those just entering, welcome and find a seat. March forward. It's time to turn promises into progress. True progress, it demands equal representation, continuous learning, valuing diverse experiences and perspectives, and meaningfully inclusive decision-making processes. My name is Kelly Dunn, and I am the very, very proud CEO of Women's Health Loddon Mallee. Can you tell by the big smile I've got on my face? And together with the Women's Health Loddon Mallee board and staff, I welcome you here today as you are, as a community, to keep the spirit of learning and belonging as we amplify the voices and experiences of diverse women and mobilise actions towards achieving equality for all women and gender diverse people. This year's International Women's Day theme is a powerful call to action, and I hope you felt that. I think I can feel it in the room already. This call to action is to march forward together to create a gender equal future where no one is left behind. Today's event, it helps us unite to dismantle the ongoing barriers to gender equality, particularly for those considered to be more marginalised. Let us march together to create a gender equal future as today we reflect and listen with the aim to identify some actions inspired from the incredible women who I will introduce as we move through the next few hours together. We also had, by the registration table as you came in, some information tables with these wonderful cards, and no, you don't have to purchase them. They're there for you to take. If you come from a workplace where you feel you can utilise these, take a couple. It's more than okay. And these are our gift to you, and you'll hear a little bit more about these cards as we move through today. It is now my greatest pleasure to introduce to you Auntie Marilyn Nichols, who will officially welcome us to country. Now, Auntie Marilyn Nichols is a recognised Victorian artist and traditional weaver practitioner based in Woodwood, Victoria. Auntie Marilyn's apical ancestry connects her with both freshwater and saltwater country of the Murray River, Victoria, and the saltwater people of the Coorong, South Australian coastal regions. I would now like to invite her up to the stage. Thank you.
Better put the glasses on so I can see what I've written. Thank you, Kelly, for that introduction. So good morning, everyone. I'd like to introduce myself. My name is Marilyn Nichols, and I'm a Dja Dja Wurrung elder and considered to be an aptical ancestor family group line of the Emma Kerr line of the Bendigo Creek area, and also the Yumbalung people of the Bort area. These two places are well within our recognition settlement agreement of the Dja Dja Wurrung peoples. I work with Dja Dja Wurrung clans, and my work involves multitasking, working in the office, working out in the field, healing country and healing waterways, working with people of who have not have worked with Aboriginal people before, and it involves a lot of cultural sharing and understanding in my position. I do this in a team approach with many other Dja Dja Wurrung peoples because we are the people that speak for country, and to try and help others to understand what we see and how we see our cultural values in the landscape. I share my culture and talk about how Djara women might see their roles in caring for country as well. We play an important role, and in the past we've not been able to do that through the eyes of colonisation. But we have now picked up that task of traditional practices. One of those include using our traditional tools such as digging sticks and welcomes to countries and welcome babies ceremonies. Djara country is encompassed by other traditional owner groups. East we have the Taungurung peoples and the Yorta Yorta nations. In the south we have the Wurundjeri peoples and the Barong people. And east we have the Burunji Gadjin. And then into the north we're encompassed by the Barapa Rapa people. Our country is one from the creation times of many thousands of years ago. We know that this through Jara stories about the creation of our lands and our waterways and our landscape and of sacred places within the landscape. These stories have gone from generation to generation, and we now speak those stories. In fact, you might see a lot of our stuff in some of the building structures in Bendigo itself. Jara cultural practices and customs are carved from the Dja Djurrung Aboriginal ancestors of the past and keep us connected to our past and our present and well into our future. And this, we believe, is our living culture. We actively practice our ceremonies, and today I would like to officially welcome everyone to this ceremony. This is actually a great event. I'm a little bit nervous about all this, but I've been 38 years in Aboriginal health and I've stepped out of it for a while to do environmental health and wellbeing, which is still about putting people in country and taking care of country and people. So welcome everyone, and in saying this, Wamanjika, Jara Jandak, Wayaparang, Gundalkanya Marab, which means welcome to Dja Djurrung country. We all come in good health and good being, and welcome to the spirit of this gathering. And thank you very much.
Thank you so much, Auntie Marilyn. And I always sit in awe when I hear incredible elders of our community keep challenging us, but also welcome us to be part of this journey. And I promise too to walk gently on your lands today. I would now like to invite up, and I don't know whether I've lost her. Oh no, you can come up, Melissa. Melissa Silk, our Deputy Chair of the Women's Health Loddon Mallee Board, who will be speaking on behalf of Dr. Skye Kinder, our Board Chair, who can't be with us today. So welcome, Melissa.
Thank you all, and good morning. As Vice Chair, I'm pleased to welcome you to this event for International Women's Day on behalf of the entire Board. I'd like to begin by acknowledging the traditional custodians of the land in which we gather on today and pay our respects to elders both past, present and emerging. And in particular, I'd like to highlight the women whose leadership, strength and wisdom continues to inspire us. I'd like to also extend a warm welcome to our special guest whose presence enriches this occasion today. Unfortunately, our Chair, Dr. Skye Kinder, couldn't be with us today, but has prepared a letter that I'd now like to read out to you all. To the audience, I am sorry that I cannot join you this morning for what I am sure will be an amazing celebration of women in our community. As you may be aware, I've had the great privilege of serving as the current Chair and Board of Women's Health Loddon Mallee. In my day job, I work clinically as a doctor in the field of mental health. Outside of this, I'm 34 weeks pregnant with my second son, and I'm unfortunately under the weather right now. While disappointed to not physically be present with you all today, I think it's important that I do not attend, particularly as it is International Women's Day. I say this because as women, we are so frequently expected to make choices and sacrifices that are not expected of our male colleagues. Many of us have internalised the pressures to say yes when we should be probably saying no, even when it comes to our own health and well-being. As a medical woman, I think it is particularly true. Reflecting on my own field, we know that women in medicine are more likely to participate in unpaid volunteer, mentorship and pastoral care roles in our workplaces, more so than our male colleagues. We do this because we want to contribute positively to our profession in support of our colleagues and in service to our patients. However, we also know contributing substantially to the departments through these roles, we are still underrepresented in formal leadership. Indeed, there is a saying in medicine that there are more heads of department named Peter than heads of department who are women. This is only partly a joke, even with my own specialty of psychiatry, which is considered one of the more female-friendly specialties, whatever that means. We still see this disparity, and the irony is that my head of department is named Peter. This is backed up by data from the Royal Australian and New Zealand College of Psychiatrists, which shows that in our field, 79% of clinical director roles across the country are still held by men. Another 80% of senior academic roles are still held by men. And another 63% of college committee chairs are men. And more than 75% of keynote speakers at official college conferences have been men. We also know that unfortunately many medical women struggle with pregnancy as a consequence of the gender inequities that are embedded within our workplace. There is new evidence showing that 30% of female doctors will require fertility testing, 36% will suffer pregnancy loss, and 50% will experience pregnancy complications. These are terrible statistics. With these reflections in mind, I hope that the decision not to join you this morning is both understandable and perhaps even a powerful right in its own small way. Although we are not expected to do so, the choice to prioritise our health as women is ultimately an act of defiance against patriarchy in support of International Women's Day 2025. It is through the work of organisations like Women's Health Loddon Mallee that I have gained the courage to make these choices for myself, and I hope that you will too. Thank you, and see you soon, Dr. Skye Kinder. Dr. Skye Kinder's words inspire me, and I trust that they inspire you as well. The Chair's letter urges us to be conscious of our daily choices, highlighting the importance of communicating boundaries, prioritising ourselves, and creating supportive spaces for each other as women. It emphasises that our voice matters, our boundaries are sacred, and mutual care is essential for building a more equitable future. My mother is here, and she was a great influence on demonstrating what strength and resilience really means. I stand before you deeply grateful for the groundwork laid by incredible women who came before me, women who have paved the way for a better future. But I'm also reminded by the presence of my daughter here today how critical it is to keep marching forward. This is important for an equitable world, and we are all part of the equation. Thank you for reminding us, Skye, of the strength and power of choosing ourselves. By taking control of our own well-being, we not only resist the systems that often demand too much for us, but also honour ourselves, each other, and the future that we create for generations to follow. I also want to acknowledge the invaluable work of the organisation of Women's Health Loddon Mallee, which promotes and empowers women to make choices that are right for them. Together, we can continue to build a future where health, voices, choices are at the centre, and that we're empowered to live our truths. Thank you for being here, and I really look forward to enjoying the morning with you. Thank you.
Oh my goodness, well done, Melissa. Stepping in with a few days' notice is a luxury sometimes, but also not. I really appreciate the leadership that both you and Skye have provided to us here at today's event. Our next speaker may not need much introduction to some of you. However, this is a woman who I sat with last week and was deeply in awe of the incredible work that she does in advocating in a space that I'm so very passionate about in equality. So Marie Edwards, we invited today as our keynote. Marie has been a member of Victorian Parliament since November 2010 and was re-elected in 2014, 2018 and 2022. Now, Marie serves as a Speaker of the Legislative Assembly, which she has held since August in 2022. Previously, Marie served as Deputy Speaker from 2017 to 2022. And I loved that at the very bottom of her bio, and I thought, we're going to have all of our speakers' bios available on our post surveys and everything that go out to you after today's event. But this part for Marie's, I did not want to leave out. Marie is a mother of 4 and grandmother to 2 grown-up children and stepmother to 2 grown-up children and a grandmother of 10, which I think is incredible. Might have got that math wrong. But anyway, Marie can come up and let you know. I just think that's amazing. So welcome, Marie.
Thank you, thank you, Kelly. Yes, number 12 was born in December last year, so they just keep producing children, and I love it. I love it. Thank you so much, Kelly. Can I also begin today by acknowledging the First Peoples and traditional owners of this land, the Dja Dja Wurrung people, and pay my respects to elders past and present. Of course, to Auntie Marilyn, thank you so much for your warm welcome this morning, and to any other First Nations people who are joining us today to celebrate International Women's Day here in Bendigo in our beautiful town hall. We have lots of really important people here as well. The Mayor is here, Andrea Metcalf, as well as Councillors Core, Councillor Prince, Councillor Shatley, and I think that was all. 3 of you? Yes, 3 councillors today, so that's wonderful. Can I thank Kelly as well, our new CEO of Women's Health, Loddon, Mallee, for the invitation to join you today. Of course, to Dr. Skye Kinder, we wish you all the very best as you get closer and closer to that due date, and I hope that you stay well. And what a wonderful speech you gave us this morning. Of course, to Deputy Chair Melissa Silk, thank you for stepping in at the last minute, and well done to you as well. Importantly, to the board members of Women's Health, Loddon, Mallee, and of course to the wonderful staff who make Women's Health, Loddon, Mallee actually tick over. Thank you so much. This year, as Kelly said, as we join together to celebrate International Women's Day under the UN theme, which is a powerful call to action, march forward for all women and girls' rights, equality and empowerment. And it's time to turn promises into progress. So I wanted to talk a little bit about what we're doing here in Victoria in relation to progress, particularly in relation to women's health and gender equality. Victoria is, in fact, leading the way. We are committed to improving the health and wellbeing outcomes of girls, women and gender diverse people in particular through the rollout of women's health reform initiatives. And we are delivering deliberately comprehensive and women-centric health services and systems, and taking a strong stance to reduce medical bias and address systemic access barriers and gender pain gaps. Many of you here today would be familiar with the progress that has been made so far, but I just wanted to touch on a few areas. The Women's Health Reform Package announced in May 23 includes $153 million, an investment over 4 years, and 12 key initiatives aimed at changing the way women's health issues are treated. And can I just say what a fantastic 12 months it has been for progressing women's health here in Victoria, and that none of this work is possible without the leadership, the expertise and support of those across the sector, including all of the women's health organisations across Victoria. Thank you for your input, and we are so very grateful for all of your contributions. I'm also pleased to share just some of the recent developments, as well as a wrap-up of the work achieved to date as part of the Women's Health and Wellbeing Program. In particular, the focus on rural and regional women and girls, and offering more choices and services to them so that they can access high-quality, non-judgmental and inclusive care closer to home. One of the things that I'm really most proud of and quite passionate about is a policy that has been rolled out for some time now, but not really talked about because we still have a bit of stigma around this, but that is the rollout of pads and tampons in our schools and public places for women and girls. And this has been a game changer. It's been a game changer for young girls at school, and it's been a game changer for women, particularly in a cost of living crisis. We've also established 5 multidisciplinary women's health clinics, one, of course, right here in Bendigo, removing the barriers women face when trying to access specialist care, delivering more services closer to home, including pelvic pain, heavy bleeding, prolapse, incontinence, contraception, and menopause services, with another 5 clinics opening in the first half of this year. And an additional 10 women's health clinics will be rolled out over the next 2 years. These clinics are providing multidisciplinary women's health services close to home, including contraception and abortion care. The women's health clinics include registered nurses, nurse practitioners and healthcare specialists, such as gynecologists, urologists, allied health professionals, including physios and pain support specialists, social workers, psychologists, dietitians and care coordinators. And of course, the aim is to make it easier for women to access specialist care for conditions like endometriosis. Despite what some in the media might say, it actually does exist. Pelvic pain, polycystic ovary syndrome, perimenopause, and of course, menopause. We've also partnered with Breast Screen Victoria to deliver the mobile outreach women's health service for girls, women and gender diverse people residing in regional and remote Victoria. The mobile clinic is being delivered on board 2 existing BSV vans named Nina and Marjorie, purposely refurbished to travel to remote and regional Victoria and provide sexual and reproductive health services close to home, including contraception, some sexual health testing and treatment, facilitation of access to medical termination and referral for surgical termination and other local health services. And this builds on top of an existing mobile breast screening service that operates between the 2 BSV vans and travels to remote and regional Victoria. The mobile clinic will focus on provision of services, in particular to Aboriginal and Torres Strait Islander women, and has strong connections with the network of Aboriginal community-controlled health organisations, our ACCHOs, and their local communities. Women will be able to receive confidential, safe and free consultations for sexual health testing and treatment, contraception, medical abortion and referral to surgical abortion, as well as other local health services available in their community. A nurse practitioner has been recruited and the mobile clinic services commenced in January this year. And the van has already visited Mount Beauty, Edenhope and Dalesford this week, and Nina was in Bendigo yesterday to visit Badak. Recently you announced that we will deliver a statewide free virtual women's health clinic, making it easier for Victorian women to access services like endometriosis and pelvic pain care, menstrual health, cervical screening, menopause care, breast health care and abortion. Led by specialist nurses, it will reduce barriers to care, including for women in regional and remote Victoria, where access to services, as we know, like contraception and abortion, is hard. This service is more important than ever. Barriers and delays in accessing care can have detrimental impacts not only on a woman's health, but on their quality of life and their ability to participate in education and employment. We've also expanded the network of women's sexual and reproductive health hubs to 20, with 12 regional hubs in Victoria and 8 in Melbourne, delivering sexual and reproductive nurse-led free or low-cost care, including contraception, medical abortion, referral for surgical abortion and sexual health testing and treatment. And just on another note, here in Bendigo, we recently opened the new state-of-the-art Bendigo Early Parenting Centre. Local families now have access to expert advice and care tailored to their needs. And this fantastic facility offers free specialist sleep, settling and feeding, parent and child health and wellbeing support, and help for families across the region to navigate the challenging early years of parenthood. And of course, you'd all be very familiar with our government's significant investment in free TAFE, including, as part of that package, free nursing and midwifery study, and in the early childhood sectors, areas where women are more likely to make up a majority of the workforce. This all contributes to the health and well-being of women. And of course, there are many services now that wouldn't be anywhere without our amazing health workforce, the workforce that is now supported through our scholarships program. More than 150 scholarships were distributed in 2023-24. And at the same time, we're also working to deliver Victorians a better connected health system, one that ensures patients get the care they need sooner and in their local communities. Women across the state, including in Loddon Mallee, will be able to access a local network of well-integrated services that will effectively support them across all life stages, and this requires strong collaboration across the sector, with health prevention and promotion services, primary care, as well as tertiary services, and building on top of the fantastic work that is already underway in our wonderful Loddon Mallee region. Every single one of these services is being designed to strengthen the system so that every woman and every girl can have access to women-centric healthcare services that are available, acceptable, appropriate and affordable. And we are delivering services that meet the needs of all women by providing safe, effective care grounded in equity that is evidence-based and strengthening the workforce skills and capacity to support this model of care. Kelly mentioned that I was the Speaker of the Legislative Assembly, and if you will indulge me for a few moments, I'd like to tell you a little bit about the work that is happening at the Victorian Parliament. So I'm the 4th Speaker of the Victorian Parliament who is a woman in 170 years. It's pretty good, right? So, well, actually, we could have done better, but that's okay. So next year, Parliament turns 170 years. When I became Speaker, I looked around Queen's Hall, and I'm not sure if any of you have been to Queen's Hall in Parliament, but around the walls are the portraits of premiers past, mostly men, one portrait, Joan Kirner, of the woman. And I thought, this is wrong. There must be other women that we have portraits of who have made a significant contribution to the Victorian Parliament. So I got our librarians to do a bit of hunting around the building, and we found some, and we put them on the walls, and that was for International Women's Day in 2023. And on that day, I also announced that we would have some portraits done of our first woman Speaker and first woman President, Judy Madigan and Monica Gould. It's a little bit of, what are we doing that for? That's a lot of money to spend on a portrait, to hang on the Queen's Hall. But, oh my God, it's amazing to see the women who come into Parliament to see the women hanging on the walls in those portraits. And last year we unveiled them. And that was just such a wonderful celebration. One of the other things that I noticed about our wonderful Parliament building is that dotted throughout the building were a lot of marble, I don't know how else to describe it. I think they say marble statues, but they were mostly marble heads, busts of men, dotted all around the building on pedestals. And I had no idea who these men were. And I said, why have we got all these marble statues and heads of men all around the building? And no one could really tell me except that they'd been there for 170 years or whatever. So in Christmas, the year before last, I had them all removed and put in storage. And I thought, oh my gosh, I'm going to get some kickback on this. There's going to be some members who will be very cross with me once they find out the marble statues of the men's heads have gone. Nobody noticed. Nobody noticed that the men were gone. And that was a bit of a revelation for me. But one of the things that I'm most pleased about is that this year, end of last year and into this year, we have 5 women members of Parliament who've had babies. We have 5 babies in the Legislative Assembly, 4 boys and a girl. I know, right? Anyway, the women came to me asking about how they could bring their babies into the Parliament and be safe. And so over the last few months and weeks, over the Christmas break in particular, we allocated a space. We had to do some rearranging because space is of a premium in our old building. But we now have allocated 2 beautiful rooms, a middle room and an outdoor area as a carer's space, so those women can have their babies in Parliament. And this is really, yes, I know, first time. Importantly though, it is a cross-party supported project. So the three women who are utilising that space at the moment, one is a National Party member, one is a Liberal Party member, and one is a Labor Party member. And they have combined their resources to bring in an educator to care for those babies while they are in Parliament, which I think is a great outcome. Importantly, 22 years ago, on the 18th of March this year, the Speaker of the House at the time, Judy Madigan, who was the first woman Speaker, was confronted with a Member of Parliament who dared to bring her baby into the chamber and breastfeed that baby. Some of you might remember Kirsty Marshall brought her baby in and fed the baby. First time ever, huge outcry, made front page of the Herald Sun. And so I thought, well, why don't we name this carers room after that event? And so on the 18th of March, in just a couple of weeks, we will be naming that carers room Charlotte's Room after the baby. And just finally, I could stand here and talk about this all day, but I just wanted to say a couple of things about the Parliament more broadly. For the first time in history, we have 50% representation by women parliamentarians. We have a woman governor, a woman premier, a woman attorney general, a woman treasurer, a woman minister for emergency services. Obviously, our minister for women is a woman. Minister for Health, Minister for Energy, Minister for Community Sport, Minister for Roads, and I could go on. They are all women because there is over 50% women now in the government's cabinet. And, of course, I'm the Speaker as well. So we're doing pretty well, I think. We just have to maintain our solidarity. Women's voices around the cabinet table, women's voices in Parliament make a big difference. And you can see that from what I have just outlined to you today around the progress that is being made around women's health in particular. Women's voices call for change, and women's voices make change happen. So thank you so much for having me here today. I think that we are very fortunate here in Bendigo to have such a wonderful collaboration of women across our health sectors, indeed across our many services. As I often say, in Bendigo we do it best. And I think that is true because I can just see from all the women's faces I can see here today, and I know many of you, that you have been working in this industry in women's health for a long time, but the collaboration that comes from working together makes a big difference. And the big difference it makes is to all of those women out there who seek your support and your services. So thank you for everything that you do. And so let's all march forward together, and happy International Women's Day. Thank you. Yeah, I'm not done yet, sorry. This year, Women's Health Loddon Mallee is celebrating a significant birthday milestone. Since its inception in 1989, Women's Health Loddon Mallee has been committed to promoting women's health, well-being and equality in the Loddon Mallee region. Over the past 35 years, they have made significant strides in advocating for women's rights and supporting the community through various initiatives and programs. And I would like to officially launch the celebration video of Women's Health Loddon Mallee over the last 35 years, highlighting previous leaders that I've had the pleasure of working with, Jennifer Alden, Linda Bielhaas and Tricia Curry, who will share their journey and describe the sector and organisation in their tenure, which was so influential. They are joined, obviously, by our current CEO, Kelly Dunn, and our Deputy Chair, Melissa, for this 9-minute feature video, which has been expertly guided by videographer Mitch Nivalis. So please join me in enjoying a 9-minute video. Thank you so much.
We're proud to be celebrating 35 years of advocating for women's health and wellbeing in the Loddon Mallee region.
There were many women in this community who fought for this organisation to even exist and who have worked tirelessly over countless decades now to expand the organisation to the much larger presence that it has across the entire region.
Over the years, we've had some name changes. We've also had some logo changes, because who doesn't love a good logo?
The representation of what looks like a sun was intentional, and it was representative of water. They were heavily informed by input from Indigenous women. The previous CEO before me, Julie Rivendell, had a lot of connections into the Aboriginal community, particularly in Nyunda and Echuca and Robinvale, and so that became a constant theme. Regardless of how a logo was revamped, it was still there.
And of course, we've had some changes to our location.
The thinking was quite groundbreaking for the time to purchase a standalone building, and that was to give security of tenure for a women's health service. It was the first time it happened in Victoria. It was very significant. We received quite a bit of feedback from women that when we moved from a more central position in Bendigo with a higher profile sort of on the street front, there was an increase in women who came in to talk about violence and what was called domestic violence or violence against women at the time.
As needs have changed, we've adapted. Moving from service delivery at a time when there were gaps for women to upstream advocacy, which is where our focus is now.
I think that the women's clinics were something that people understood quite clearly. The outreach for that was quite extensive. So we had women's clinics here in Bendigo, but also in the Oyen office. We had an office in the Mallee.
In my time, it changed between defining more clearly what upstream meant. In Oyen, the women there were loved by that community, and it was seen as a really, really important thing, which just made it so hard to say farewell to them. But in the end, the role of the service sort of changed how it did its delivery.
All throughout our history, we've advocated for change and for the improvement of women and gender diverse people's health and wellbeing.
So getting gender and health recognised in that original 2002 Women's Health and Wellbeing Plan was a bit of a breakthrough. It's assumed now, so this is the legacy stuff, that it's nice to think that people would assume, of course, it would be part of any health and wellbeing planning, but it wasn't back in the day.
The gender equity cards that were done were a conversation starter tool, and those cards were ways of articulating what gender equity is, because we had the issue of trying to explain what we were talking about to people who didn't understand.
We know, and the evidence proves it, gender equity doesn't mean you give something up. It actually means that we all gain something together.
One of the biggest breakthroughs was the recognition of violence against women as a responsibility of the government. So that came through right at the end of my time when Victoria recognised that violence against women was a crime. So that then meant that they funded services, and they did put some money into the primary prevention, which was the role for women's health, Loddon Mallee.
And we knew that the data that was being collected around women's safety and in terms of, gender-based violence was red on every map. But the important part of that work was to actually engage with women, girls and gender diverse people, because their stories, their lived experience is the data, is the qualitative evidence to the work that needed to be done. We then developed the next iteration of a regional strategy called the Collective Action for Respect and Equality, or the CARE Partnership. That was absolutely essential in foundational partnerships to take action.
Sometime during my time, issues of abortion came up. Now that had always been present, but medical abortion was something that was becoming more available, so it was trying to get doctors to prescribe it.
In the Loddon Mallee region and in rural Victoria, access to abortion services were so difficult and in many regions non-existent.
So you try and get the morning after pill in the local chemist, where a pharmacist might be a male Catholic. There were barriers. Equally in Bendigo, women couldn't get an abortion in Bendigo because doctors feared losing their consulting access to the Catholic hospital.
It was important for us to look to see strategically how can we create a framework to generate conversations, to generate change. So we did develop the first regional sexual and reproductive health strategy called Her Health Matters. And in its first iteration, we travelled across the region talking to people about things that were important to them.
When it comes to, mental health, there are a variety of ways in which women are unfortunately overrepresented within the patient population.
In understanding, what mental health and wellbeing is, it's actually saying, well, how do we address some of the inequities that sit behind that?
Women's Health Loddon Mallee has been really key in starting to think about how we have conversations to ensure that policies that exist around mental health are actually purpose-built for women, and ensuring that we actually have lived and living experience representation.
So when someone can see themselves in the stories that get told, they feel a connection. We actually introduced Women in a Changing Society.
We were starting to become really aware in 2006 with the drought of a huge impact on women's health.
I always remember water being a super scarce product, and when it rained being like, oh my God, it's raining, because it didn't rain that much when I grew up.
And looking at it from an intersectional lens. So how does that experience affect a woman who is from multicultural background, living in a rural area, who is feeling quite isolated and natural disaster hits?
And yes, women understood the link between the increase in violence they were seeing because of that, but they were so overwhelmed with what was at hand and surviving, they couldn't take on the bigger issue picture of that environmental issue.
A key program within that priority is actually Women Rising. That work has been beautifully translated into evidence, and that evidence has been taken at a statewide level, presented at many conferences, national level as well, really promoting the importance of understanding where inequity occurs through natural disaster.
There's a new portfolio, and that is chronic disease prevention.
Women are not represented in research, clinical trials relating to things like chronic disease management.
The Victorian Women's Pain Inquiry had an incredible response, and we worked really closely with that inquiry in our region, bringing people together to talk about pain.
We can make such a difference in helping women, particularly in regional and rural areas, understand what's available for them so that they're not on their own.
If at the very least we can actually put that gender lens and the inequity around women's pain as part of that chronic illness, that would be a very, very helpful thing to do to address inequities in terms of health outcomes.
I would love to see every rural and regional woman know what Women's Health Loddon Mallee is, and to feel as proud of it as I do, because they can see the change that this organisation has made.
When I think back to the start of Women's Health Loddon Mallee, the world has changed so well for women.
We need a new generation, a remotivation of advocacy and understanding that these hard-won gains can be very easily lost.
We can't have change without the small conversations that become the important conversations, because the work's not done.
Imagine if we had a world where girls and women felt safe. Now is the time to turn promises into progress. Thank you so much for sharing that journey with us. 35 years is not usually a milestone that we celebrate, but with everything happening in the world at the moment, we need people to understand where we've come from, but that we have a long way to go still. And the panel that we are about to immerse ourselves into represents that next step for us here at Women's Health Loddon Mallee in terms of strategising and creating community conversations to keep this going. But I can't help but get a little emotional when I see the incredible three leaders that so graciously said, yes, Kelly, we see your idea and we'd love to come along. And so I would just like to ask Tricia and Jenny if you'd like to come up. Linda couldn't be with us this morning, but just to receive a small thank you. It really is on the shoulders of the leaders before us that we stand. It is definitely showing the groundedness and the strength from which we now emerge into our future. A shout out to the incredible Mitch Navalis. Mitch, you did an incredible job putting that together. I think it was 25 minutes at one point. And I'm like, I don't want to cut anything out. And Mitch is like, come on, we've got to do it. So thank you so much, Mitch. Just a clap for Mitch and the work that they put in. Okay, so an opportunity for anyone who would like to take a seat, for anyone who'd like to stand to now go stand. As we bring up our incredible panellists now to have what I'm hoping will be a really heartfelt, it could be challenging, but an inspiring conversation for us all here today as we now understand the obligations that are before us. So I would like to now, and panellists, you can make your way up at any time. We have Shireen Clow. So Shireen Clow is the LGBTIQA+ Wellbeing Officer at Dalkaya Health in Castlemaine. She spent the last 8 years as a vocal advocate for the LGBTIQA+ inclusion in the Mount Alexandra Shire, and is not only an employee for Chirp Community Health and Dalkaya Health, but also as a social commentator on Main FM's Queer and Now program, founding member of the Castlemaine Pride Festival and an ongoing original member of the Mount Alexander Shire Council's LGBTIQA+ steering group. My goodness, Shireen, do you sleep? Welcome. Now, we'd also like to welcome the incredible Eliza Hull. And Eliza, I haven't seen where you are sitting. Oh, there you are. Thank you. So Eliza is an award-winning musician, writer and passionate disability advocate. She's the creator of the AB series We've Got This, which explores parenting with disability. The series went on to inspire an internationally acclaimed book of the same name. Now, Eliza has appeared on prominent platforms such as the BBC, The Drum, ABC News Breakfast and ABC's Q&A. She's also a contributing writer to the anthologies Growing Up Disabled in Australia and Teacher. A writer for ABC News, a producer, again I have a feeling someone else who doesn't sleep very much. She has also presented at Parliament House, the NDIS, SXSW and the Free and Equal Human Rights Conference, and she's deeply committed to advocating for a more accessible music industry. Eliza Hull, everybody. Our next panel member is Dr. Kirsty Forstyke. So Kirsty, you can make your way on up. Kirsty is the Associate Dean, Research and Industry Engagement at La Trobe Rural Health School in Bendigo. She's an Associate Professor and Principal Research Fellow at REGEN, Reducing Gender-Based Violence Research Group at the Violet Vines Marshman Centre for Rural Health Research. Now, her research focuses on organisational responses to gender-based interpersonal violence through a feminist socio-ecological lens. And her research work to date has looked at organisational responses across health, sport and recreation and the public service sector to intimate partner violence, family violence, sexual assault and harassment and violence against women more broadly. Welcome. I would now like to welcome the incredible Dulcie Murdos. Yay! Dulcie. Been practicing Dulcie's name with her. Dulcie is an advocate for refugee rights, food security and institutional accountability. She has provided complex case management for people sent to offshore detention, working alongside the National Justice Project and Alison Battison to fight indefinite detention. Now, as part of the emergency protocol for food insecurity in Greater Sydney, she helped lead urgent food relief efforts. Now, as redress advocate at our Loddon Campaspe Multicultural Service, she supports survivors of institutional abuse, applying a trauma-informed, feminist and decolonised approach. She's extremely passionate about migrant women's contributions to culture, work and social movements, and continues to push for systemic change. And her work has been recognised with multiple awards, including the Edna Ryan Award, City of Sydney Humanitarian Award and New South Wales Health Community Service Award. How great that we now have her in Bendigo. Welcome. And our last panel member is the incredible Auntie Marilyn Nichols. Please come up, Auntie Marilyn, who has said, I will want to go last. So I've honoured that. Now, Auntie Marilyn, as you heard me give a little bit of a bio to her before, but I just did want to read this section out here. Marilyn's professional career spanned 38 years in healthcare, Aboriginal health and community development. And after retiring from the health system, Marilyn travelled overseas, spending time with other First Nations people to understand and exchange cultural and spiritual knowledge. I just thought that was so powerful. Thank you so much, and big clap again for all of our panel members. Now, panel members, I'll be standing here and asking you some questions, but hopefully it feels quite intimate with 200 plus other people. You have water under your chair, which you're more than welcome to grab at any time. And of course, remember that we are amongst friends here, so it doesn't matter if you stumble over your words, everything here is okay. Now, just a little point to note, and for those who feel so inspired, if you hear something today from our panel members, and I'm specifically asking you all to help out if you hear a call to action, a gap, or anything that inspires you that you think we need more of, we have some flip charts down the back that represent each of the lenses, the intersectional lenses that our speakers are talking about. I encourage you to grab a sticky note, write that down and stick it up there. We have our staff from Women's Health Loddon Mallee, incredible staff to be able to help you. And you will have time during the networking opportunity where incredible Eliza will be playing some music for us to also be able to contribute your thoughts. We want to capture these because we believe so much in hearing from these incredible women here today and the wisdom, knowledge and sharing of the lens that they represent. We want to build this into our strategy at Women's Health Loddon Mallee, but more so we want to hold ourselves and the community accountable to the experiences and to the vision of these incredible women sitting on the stage here today. All right, are we ready? Now, our first question, there's two facets to it. So I can remind you again if that's which facet you may have forgotten, because I'd love to hear from all five of you. Auntie Marilyn has dibs going last. All right, so but for anyone who has got their mic on and is ready to dive in, that'd be great. So our question to all of you is, what are the key issues that women face today where immediate action is needed to turn promises into progress for women, girls and gender diverse folk living in the Loddon Mallee region? And then the second part to that is, so first one, what are the key issues that we face, and then how can we effectively address these issues with your thinking and experience? Okay, who'd like to go first?
The biggest issues we're facing, I think, still in this region, let alone all the other regions in Victoria, is the violence that women and gender diverse people are still experiencing, despite all the efforts that so many people, including those in the room, have made. The area of research that I spend most of my time in these days is sport. I love sport. I'm sport obsessed. I think it's a wonderful place to be, but not all the time. And Again, the investment has been brilliant to a certain extent, particularly from the Victorian government. A lot of money was invested a couple of years ago to primary prevention programs to be rolled out across Victoria, including in the regions. And we did a study here, it's still going, where we worked with community to understand what they knew was happening and what we might be able to do about it. One of the biggest things that struck me was the lack of recognition of the types of violence that still occurs against women and gender diverse people in the sporting space. The fact that it was still so normalised that people didn't necessarily know to put their hand up to say this is wrong, let alone a lack of systems and procedures that people could use to speak up and actually feel safe in these environments. So that is still a big issue. And the thing that concerns me the most is that obviously very recently in our news locally, we've got the Kyneton Football Women's Club, who very bravely made the decision to stand up and say no more, to leave a club that was not welcoming to them, where they didn't feel safe. And all they've been faced with since, apart from wonderful support, hopefully from people in this room, is a massive backlash. The comments that these women are now receiving because of this decision they've made is appalling and unacceptable. So for me, for women to feel safe, for women to be able to speak up, for women to be able to do the day-to-day stuff we should just be able to love to do, to play footy. Hands up, I don't play footy, by the way, but I appreciate lots of people do. That should be a real priority for us in this region, so that women can actually spend day-to-day doing the stuff they love. And not receive horrendous comments about it and the decisions they make. So I think that, for me, is one of the biggest issues at the moment locally.
Yeah, beautiful. Thank you, Kirsty. Who else would like to go?
Yep.
They're so polite.
Yep. Hi. I guess I want to say that I moved from Melbourne to Castlemaine, and that was a big jump as somebody that lives with a disability. I faced a lot of discrimination in the healthcare sector as a parent with a disability in Melbourne, where I was questioned and there was a lot of stigma around my own disability and passing on my disability, which is why I created the ABC series on parenting with disability called We've Got This. And when I moved to Castlemaine, I did see a huge, I guess it felt like in a way I'd kind of almost joined a little bubble in terms of how beautiful that community is. There is so much, I guess, acceptance in my local community, and the local kindergarten, the local school are constantly wanting to make sure they are disability aware. But in saying that, I do still spend a lot of time with people with disability in Castlemaine and also here in Bendigo, as in my advocacy role, but also in creative roles where I spend a lot of time with people where they share their music to me, or we do writing workshops at the Bendigo Library. And a lot of women with disability still very much feel marginalised, still feel that they can't access healthcare. A lot of services are still not accessible for people that are blind or deaf, and I think often they don't know where to go, and that's a big issue. That it's just that around that awareness. I think another, greater problem in society widely is loneliness. And a lot of women with disabilities still feel very much on the outskirts of society and don't feel like they're celebrated enough. Often there's not enough community building or spaces where they feel like they can be fully accepted and celebrated. And so we are therefore seeing a lot of poorer mental health outcomes. Even though we are such a connected society in many ways and through technology, I think a lot of people are facing loneliness, especially women. And the other issue that I'm hearing is women not being able to find accessible housing with disability. So I was just speaking to a woman locally who is being placed in an aged care facility and wanting to be with peers, wanting to be with people her own age, and yet her family aren't able to find her affordable, adequate housing. So that's another major issue. So I guess in terms of answering around solution, there are many ways to make it better, but I guess for me it's all about, disability awareness training in organisations, more accessible services so that people with disability know where to find healthcare services and know that when they go into these healthcare services that it's going to be accessible, it's going to be inclusive, and that they're going to be treated well, because I think that is such a big thing, that not only do we need to change the world with the barriers, but we also need to be treated appropriately and in a kind way. More housing, a more accessible housing, and just more mental health support for people with disability, and especially women widely, is just those big little steps. But I think that we are on our way, and even just by having these conversations and that wider disability awareness, I'm seeing more and more women with disability feel proud about who they are.
Beautiful.
I think with the work that I do, I was employed, to touch on what you said, Eliza, for social isolation to reach marginalised LGBTIQA+ people. And that was firstly where I started 4.5 years ago, creating social support groups. And I think that's been fundamental in getting people to connect and find each other. But based on what you've both said, housing is definitely an issue. The intersectionality of the LGBTIQA+ community across all of these groups means that 40% of our community have some kind of intersectional lens, so might have neurodiversity or disability. So we can't view people just as one part of their identity. We really need to be looking at the whole person, and this often means that they're underemployed, which again makes it much more difficult to access housing or to be in line for a house against 10 other people with double incomes and other advantages that they may not have. But in terms of the work that I do at Delkaya, there's all sorts of things, including social isolation, but access to family violence services that might not seem welcoming to same-sex couples. There's all sorts of things like that. So I think I'll pause there for a moment, because I've got some more things in the coming up questions to add.
Good stuff. Dulcie.
Hi. Before I answer the question, I just want to say how incredibly humble I am to be here. Thank you, Auntie Marilyn, because you remind us that any change begins with truth-telling, isn't it? To be able to tell the truth of how we live, how we feel, and who we are. And that's a huge privilege that we take for granted. Because my work is in the multicultural sphere, I want to take everything that you have tell me and tell us all and add. I'm sorry. My co-worker teaches in Kindi, so I think she gave me the plague this week. So, I was saying that I want to take everything that these incredible women have told us and add a layer of, I come from another culture. I'm here because I'm displaced. There is a trauma and a cultural lens of intersectionality to being disabled, to be harassed, to have neurodiversity. I want to do something just to give you a sense on the presence of multicultural women. I always do something, every time I come into a room, I find a sister of color. And I am seeing very few sisters of colors. And I do that to make myself feel that I belong. So I think one of the biggest challenges that we have in the region is to make sure that everyone feels that they not only belong, that they're safe. I also am a big advocate of equity. I think we need to start using that word more and more and more. In Australia, which is a very privileged country, women make 21.8% less than men. That is forced poverty. When we make less money, We retire with less money. We face housing issues, we face health issues and chronic issues. So if we want to talk about health, we need to be honest and talk about the relationship between how much money are we making and health. And I think there's a lot of things that you already said, and I encourage to put the lens of intersectionality in a cultural space.
Beautiful, thank you.
Is it on, right?
It is on.
I'm just going to move the chair forward because the sun's peeping through that window there and it's a bit glary. I was thinking, just hearing the other ladies talk, that things have changed, but there's still a lot more work to do. So for me, it's about looking at the umbrella of health and the frameworks such as social determinants of health and wellbeing, which encompasses the many different layers on who we are as Aboriginal women. So if we have employment issues, which still hasn't changed much. Aboriginal health for women hasn't changed much, and including many other layers such as violence against women, education, succession planning. So there's many facet layers to how we look at Aboriginal health and wellbeing within our communities. And it's not just a simple task of we'll do this, we'll do that. There's a lot of discussions and a lot of thought that goes into strategic planning and how we deliver our outcomes and how we see those outcomes and how long they'll last, because often it's just a funding round, and when that funding's gone, that position's always possibly not in existent, and there goes the end of that creation of that vision for working with health and wellbeing of communities. So it's always an ongoing task to see what's available, what isn't going to make it and what is. So that self-determination is also a part of that. So I come from an area of thinking about self-determination, how do we achieve these things and how do we set our goals and how do we make them last from one generation to the next. So I guess a lot of those self-determination things are part of who we strive in our spirit and who we are as women. And we often are called the backbone to our communities and our families because we carry the many layers of the impacts upon those families and our families' structures. So things have changed and the dynamics have changed and the work is increased. So for women, it's pretty hard for Aboriginal women in communities, but we exist and we thrive and we make a community. So I guess that's probably one of the important outcomes is we can talk about things as well. Yeah, thank you.
Oh my goodness. I feel like I'm in a masterclass right now. Yeah, please. There were some common themes there, though, that I couldn't help but pick up, and that was around belonging, inclusiveness and loneliness, with kindness being a way that we can break through that barrier. My time working for Lifeline Australia nationally at a policy level, but also literally on the phones, most of the calls that came through would be about loneliness. And I just can't help but think that was for me 10 years ago, how we're still in that space. How do we tackle those feelings of loneliness and isolation and to encourage self-determination, as Auntie Marilyn has just said? Thank you so much. Now, our second question. There have been some significant strides made toward improving health and wellbeing outcomes for women, girls and gender diverse folk over the past decades. Tell us about some of the most significant influences and changes made for the lives of those in your communities. So this is nearly a positive experience of what have you seen change that has made a difference?
I think that just off the top of my head, a really simple change in our community has just been the use of pronouns. When we introduce ourselves, when we start meetings, my pronouns are she, her, and just saying something simple like that will leave some room for gender diverse people to, if they feel comfortable, to do the same. But building on what you said, policies and procedures are huge within organisations to embed inclusion and to make sure that organisations from the top down are making sure groups like ours are included. And at Dalkaya Health, we've undergone the Rainbow Tick accreditation, which is a quality framework which has a symbol for LGBTIQA+ people, that they're welcome. They can see that on any of our documentation, and signs and symbols are really important in terms of flags and lanyards like this one. But also paid roles like mine just didn't exist probably 10 years ago, and I'm only one letter of a big acronym, so I struggle sometimes to be a proper representative to all of the group. So I'm really looking at the moment that Dalkaya are giving me a reference group so people can feed in what they think the organisation needs, so it's not just one person, but honestly, one person's better than no people, and because of me being able to support volunteers and volunteer groups, they have more sustainability and more legs to be able to more broadly support the community and combat that social isolation.
It's beautiful, thank you.
Sorry. I guess the thing that I've noticed the most is just less stigma and for people with disability and women with disability. And as I said, I had children 5 years apart, and that was a really interesting way to notice the change that I faced in those 5 years. And the difference was huge. For instance, my first birth, I wasn't allowed to stand up. I wasn't allowed to move around the room because they were afraid I was going to fall. The second birth was completely different. I was able to, move into the shower, and as a person with a physical disability, I knew my own limitations. And I think just the staff at the Bendigo Hospital, Bendigo Health, had said that they'd gone through awareness training, and I think that makes such a huge difference. So I think just more conversations around disability creates less stigma. And for me, it was just, an incredible jump around the more conversations we have about disability as a woman was just a huge step. The other thing is just finding that there are more community groups starting to build. For instance, Women with Disabilities Victoria are a big part of that. Schizzy Inc., which is for people with mental health illness. Just getting people together is something that I've been seeing more and more happen, and that can really tackle that social isolation as somebody with disability and as a woman with disability.
Beautiful, thank you. They're going to go in order, aren't they? He's so polite.
Guess that's me. I think I've got two hats on, I guess, today, and the research hat, one of the biggest things for Victoria has been the Royal Commission into Family Violence. Not everything coming from that has necessarily been brilliant or perfect, but my God, that's one heck of an investment that the Victorian government made and continues to make, far above and beyond, I think, any other state in Australia. And to a certain extent, I think we're quite lucky for that. And the second hat is I'm a survivor of domestic violence. And when I think about that Royal Commission, and it seems quite, out there in the policy. But my own experience probably speaks to some of the impacts that potentially has had in a positive way. When I was able to go to the police, it finally came to a point I went to the police, and that was in Gisborne Police, so shout out to them, they handled it brilliantly. Now that might sound a little unusual to a lot of people in the room because the police are not well known for handling domestic violence cases particularly well. I found out a couple of months later from my local lawyer that if I had gone to them 2 months previously, my experience probably would have been very different. They had received training, quite a bit of training, because apparently their responses had been a bit crap. So training had been received, and I luckily was the recipient of that training. The second bit was when it went to court, the intervention order was at the Castlemaine Magistrates Court. And little things that I now realise that are huge and probably did mostly come about because of all the investment that was being made
When I went into that court, I was on my own. I don't have family here. And a wonderful woman support person was given to me, and she looked after me the entire time I was there. They found a quiet room in an old building, which we know with old buildings, they're not necessarily lots of space. And they found a room for me to sit in with this wonderful person. The police officer was there. She was constantly checking in with me, and the police had actually taken it to court in their name rather than mine, which made me feel safer. The perpetrator was in the room. And one thing the duty lawyer for the perpetrator said at one point, I think, they need relationship counselling. This is the way forward for them. They can have relationship counselling. I took a breath, and the magistrate's female said, "Don't be ridiculous, that's inappropriate in a domestic violence situation." And I was just like, oh my God, she knows. She knows, she understands. And yeah, I think that Family Violence Commission, and probably many other things as well, there are little changes being made. Now, I think my situation was probably somewhat privileged, probably somewhat unusual, but I have hope that becomes increasingly more consistent. And I think with the works that are being done across numerous different services in our local area, because this was in our local area, I think is something positive to hold on to, and we just keep needing to drive that forward.
Beautiful, thank you.
I love this question because I work in something that has made change. I work for the National Redress Scheme. And again, I'm passionate about the space for truth and what truth can do to us. But I also work with bicultural support workers in the Loddon Campaspe Multicultural Service where I work. And those people make a huge change. So the fact that the multicultural experience is now being taken account, is now being taken to be part of the co-design and co-implementation make a change. So I'm going to talk about a lovely friend. Her name is Leila, and she works with me, and she works in the hospital, and she's a bicultural support. This woman is a bridge between a system and a culture that it's far away from its place. She's not only translating, she's making the life of a person who is in pain, who is anxious, manageable. And it's translating science, it's translating medical words, and it's making her feel comfortable. Now, we don't pay enough to bicultural supporters, and I want this to change because they are carrying the emotional load, they are carrying the medical load, and they are providing awareness, but also they're in the spotlight for the community. So I think those kind of change are really important. In the space of the National Redress Scheme, the fact that we have royal commissions and we are able as a country to say we did it wrong, we're going to listen and we're going to try better, and we are implementing changes in the way we see schools now and institutions, that's something that we should be proud of and that we need to talk more. I have seen change also in domestic violence approach in the multicultural space, and I'm really proud of it, but we have a lot of work to do and we need to put money. We have to make sure that these changes are not a pilot or a one-off or something that we talk in 10 years on how wonderful they are. There's something that have to stay here, even if the government changes, even if really, really scary policies coming from overseas come. This is something that we need to make sure we protect. So yeah, that's, yeah.
Thank you, Dulcie.
Thank you.
Beautiful.
So I'm thinking more along the line, the more conversations and discussions we have as women in local communities, we raise more things and be able to come up with more ideas and develop new strategies on how we implement our thinking. And sometimes it's not easy for women to will those things forward. There's always that challenging organisational structure which is often governed by a male. I was just thinking about one of our projects that we do with the Jara women recently in partnership with La Trobe University, and it was around focus of putting Aboriginal women from the Jara back into the picture of traditional farming practices, which means using our traditional tools of turfing the land, turning the land that we had for thousands of years done to soften the earth for new seeds, for plants to grow, which are food seeds. And the importance of knowing the seasons and the understanding of plants and the landscape and the roles of the women in that nurturing of Mother Earth. So we were looking for the research around that was written around Aboriginal women in the landscape doing this kind of practice. And it was interesting to find that most of it was based on our men and what they did, the warriors of the country. And a lot of that research was written by non-Aboriginal people in that time and era who were men of society and wisdom. And I thought to myself, well, what happened to the women back then? So obviously the women were in the kitchen looking after the kids, mashing the potatoes and taking care of the society of life of what makes a family. So the researchers were all academics that wrote information that based upon their theory. So we looked at the research and we thought we need to change this for Aboriginal women, because what we were doing as Jara women was to ripple effect into other traditional owner women. So one way around it was to develop our newsletter, which is called the Murnol, or the Yam Paddock Project, and we were to extend that to other Jara women so that we get more people on side to understand the importance of their cultural practices were just as important, and not believe everything that was written about women in that time. So culturally, a lot of stuff hasn't been written properly by society in the past. They were mainly men who wrote about women from an academic point of view. So the things we read nowadays, we have to change it. So we have a PhD student that works with us on helping us to develop that change and progress in writing in literacy format of how we can implement the storyline to remake that image the way it once was. So education, understanding research and society of times and how that can affect women today is important, and how we open our mouths to speak and how we implement our stories and how we have those conversations to make change. Otherwise it's not going to happen. Yeah, so I think the communication is an important part, talking and speaking up and saying what you think, and especially writing it and make sure it gets in those PhD papers in the universities and that as well. Because that's the stuff people look at in the future for research and base their thinking around as well. Yeah.
Beautiful. Because, we are creating tomorrow's history today, aren't we? So by challenging that and researching it, and it reminds me of changing the story, for us, all that amazing work from Our Watch. Oh my goodness, we have now officially ran to our panel time, which has been incredible. Could you please put your hands together for our incredible panellists? We did have one other question that I think will be really amazing for you to grab a panel member when they come back in from their photo to ask, and that's, what can I do to continue the action to move forward? So asking our panel members that question so that you can come out of today with an action that you can do, I think will be really incredible. That's why we're all here, no doubt. Thanks so much, everybody, and I can't thank you enough for being here and supporting what is my very first International Women's Day with Women's Health Loddon Mallee, but this certainly has been an event that the community has looked forward to for many years because of the incredible leaders and staff that came before me. I just want to honour that there is a couple of our team members that are unwell today, but without their work we could never have achieved this, and we were also not panicked. So how incredible are they for gearing us up, and and that's the incredible Tina Helm and Belinda Bucks. So we just send them well wishes for getting better. But I just want to acknowledge them so much for their work. The incredible admin team and Sally, a lot of you will know Sally, were just incredible behind the scenes as well. And every other staff member who's here today, in one of these T-shirts or not, please make sure you introduce yourself to them, because we want to keep these conversations going, and we do have a pretty incredible team. All right, everybody, we have Azzy and Gab waiting by the sticky notes. Panel members will be available to you soon. Thank you so much for coming.